we can use these universal bonding agents for our direct restorations like resin composites, as well as our indirect restorations with a paired cement, a cement that pairs with the adhesive, in order to do our indirect restorations as well, like inlays, onlays, crowns, veneers, things like that. Well, the reason we're able to do that is because these universal bonding agents have very low film thicknesses, especially when compared to like fourth generation bonding agents. These universal bonding agents have a film thickness of around 4 or 5 microns if you handle them well and air thin them enough, which is very, very, very thin. So these are very, very, very low film thickness, which does not interfere with the delivery of an indirect restoration. So it means that we can have one product that we can use for all of our adhesive dentistry needs, which is great. Thanks to the MDP monomer, we can bond to resin, ceramic, metal, enamel, and dentin, all the things that we need to bond with. And we have a little bit more luxury of not needing to be so technique sensitive as we had to do in the days of the old-fashioned fourth generation bonding agents, right? One of the big advantages of universal adhesives is the idea that we get to use something called selective etching, which has a huge advantage to it in that it prevents the activation of MMPs. MMP stands for matrix metalloproteinases. That's an enzyme that lives in the dentin that begins to dissolve our dentin bond from the day that it was placed. How does this work? Well, MMPs are turned on by strong acid. Strong acid activate the MMPs. Well, could a strong acid be? Phosphoric acid etch, right? So if you look at the right-hand side of the screen, you'll see total etch, which was a method that I learned in dental school for doing adhesive bonding, especially in the posterior. That's where we put blue on everything, right? When we total etch, we get a really good bond to enamel because we need that good strong acid to etch enamel. Enamel is resilient and strong and inorganic, and it needs a good strong acid in order to etch it well so that we can stick to it. But we also put the blue, the phosphoric acid etch, on dentin, which is totally different from enamel. Dentin is organic, it is fragile, and it can easily be over-etched by strong acid, and it is over-etched in about 8 seconds. So the vast majority of us using a total etch method probably end up over-etching our dentin. So that can lead to sensitivity. Post-op cold sensitivity generally would be the thing that you would find more than anything on this. And the other thing it does is it activates MMPs. And so when we activate MMPs, we begin to break down that dentin bond. When we self-etch, we're relying on the self-etch monomer system that is in the adhesive in order to etch everything. And because of chemistry, those self-etch monomers cannot be any more acidic than around 6.7 pH. It's not very acidic at all. If they get any more acidic than that, they begin to precipitate out of the solution and the dentin bonding agent is not stable. So that's about as acidic as they can get. Well, 6.7 is not acidic enough to etch enamel. So we get a poor bond to enamel. But it is perfect for dentin. So it's great for dentin. Dentin is fragile. And so this gentle etch does a really nice job. So we get a good bond to dentin. We don't activate MMPs, but we get a poor bond to enamel. And we'll start to see stuff like marginal leakage and things like that. So self-etch is bad too. I don't like self-etch. So what's the Goldilocks? What's the one right in the middle where the porridge is just right? Well, that's selective etch. That's where we put etch just on the blue. And of course, an occlusal like this is super duper simple, right? Because we just do a rim of blue etch around the enamel. It does get a little bit harder on a class 2, but it can be done. If you use a nice etch with a nice small cannula tip, say around 25 gauge, something like that, you can really accurately place this. And that's what I recommend that everyone do. Be using a universal bonding agent, something like Futura Bond U or Adhes Universal, Scotch Bond Universal, and be using a really nice etch with a small cannula tip, like 25 gauge, to really accurately, selectively etch that enamel. You will see a better long-term bond to dentin, and you will see less post-op sensitivity. And we have lots of data to support that.